आयच्या शोचेर म्हाका जॉइन जातात गोंयांतले नामनेचे ENT स्पेशलिस्ट डॉक्टर दीपक मूर्ती. डॉक्टर, वेलकम टू द शो. So let me begin with asking a very simple question, and that when you look at the present numbers of mortality as well as positivity rate in Goa, what is your basic assessment?
Thank you for having me on the show, Pramod. Such a privilege. In any disease, recovery is always more important than mortality. The numbers who have lived are far more important than the numbers who have unfortunately perished along the way. So when you look at the numbers from January of 2020, when COVID first started in India, in Kerala, to January of 2021, when vaccination first started amongst frontline workers, especially doctors, nurses, and paramedical staff, till today now, the country, India, has vaccinated 1.19 crore people in the last 5 months. Goa, as a state, has been on the front line in testing, amongst the highest in India for testing and for vaccination. Given the fact that we are so aggressively treating this disease, I feel every reason to feel happy that we have not shown complacency and that the numbers who are surviving is increasing day by day. There is no panic in the hospitals, in the people who are treating patients, because the infrastructure is pretty much in place. There may be the occasional shortage of bed or medicine or oxygen, but then I do not see a panic because we know it's all in place. People have been very obedient. Lockdowns are being carried out efficiently. People are waiting, queuing up for beds. And so when I analyze it in retrospect, I think we are on a healing path.
When you look at, doctor, a positivity rate of about 30% and mortality every day between 30 to 50, for a small state like Goa with a population of 1.5 million, do these numbers worry you?
Not really, because our mortality of 50 unfortunate people per day on a 15 lakh population is a tiny figure. It is unfortunate that they die, but it's a tiny figure. The case fatality rate in India is the lowest in the world. The lowest in the world case fatality is in India. The lowest number of people who are actually positive or who have lost their lives in India is less than 3 lakhs for a population of so many crores. So it is unfortunate when people die. I do not say that there is no sorrow, but I feel that the case fatality is not bad and things are getting better.
Doctor, what about the positivity rate? A positivity rate about 30%, and we went as high as 51% few days back. So when you look at positivity rate, does that worry you?
So positivity rate is the number of positives that we are seeing in testing. So which means 1 in 2 patients became positive when they came in for screening or testing in various hospitals across the state of Goa. And this, I'm told, was amongst the highest in the country for almost a month running. It is difficult to postulate why the positivity was so high. People have spoken about numerous possibilities. But I'm happy that the positivity has dipped down from 51 to 32 now. And hopefully in the coming weeks, it will be down to the 10% that we were seeing earlier.
Doctor, but there is one concern is we are seeing this dip basically because of the curfew that is there in force. So what happens when the curfew is lifted and if it is not extended? And what would be your suggestion to the government? Should the curfew continue for few more days, or it is safe enough to be lifted?
The curfew has gone on now for almost 2 weeks, and the curfew is made in an effort to break the spread of virus from person to person. The virus effectively actually spreads through cough droplets from person to person in crowded environments, and therefore the lockdown tries to break that cycle. Luckily for us, despite the lockdown, vaccination has continued. We're vaccinating close to 1,000 people every single day or more. So despite the lockdown, vaccination is going on in hospitals. Opening up of the industry after 14 days will allow people to mingle again. But hopefully now people will be more careful in maintaining social distancing because they've seen the effects of the second wave.
Doctor, what will be your recommendation to the government? Are we in a position to lift the curfew, or an extension is required?
I believe an extension will only be helpful.
So extension to the tune of what, another 8 days, 10 days, 14 days from a doctor's medical
Another 14 days.
Another 14 days.
14 days till the end of the month, I believe would be useful.
Doctor, when you look at the 30% positivity rate, how worried we should be that in spite of almost 10, 11 days into the curfew, our positivity rate, although we see it coming down, it's still above 30%. How worried should we?
30% as a number is a worrisome number, undoubtedly. But our bigger problem is that the 30% is now being complicated with fungal infections, which are more dangerous in nature. 30% is a worrisome figure, but like I said a little while ago, I'm happy that the numbers are coming down. And if the lockdown persists, like you said just now, the numbers will certainly come down a little more.
Doctor, you mentioned about the fungal infections. Now that's your area. So when we talk about these fungal infections, tell us about it, because the number looks very tiny right now compared to the number of positive cases. But how worried we should be?
Not so much in the state of Goa, but then I know Rajasthan has declared the fungal infection as a major problem, and they have started putting up separate wards in hospitals only for people with black fungus, as it is termed. Today's newspapers tell me that the state of Goa has reported 6 cases so far, and Manipal Hospital, I think, is reporting 1 case now. This is just today, and in the future, the numbers might grow, since once you have aspergillus, which is the black fungus, prevalent, then it is likely to spread a little more. The reason it spreads more is also because the drugs which are required for control of this fungus are not as easily available, because this black fungus infection was not as prevalent earlier. It seems to have become more now.
Doctor, tell us, from what I read, this is a very common fungus that is all around us, even otherwise. And we inhale it, we come in touch with that fungus on a day-to-day basis. Why does it suddenly become so life-threatening?
You're absolutely right. This fungus is prevalent in the atmosphere, like other bacteria, viruses. And we inhale it all the time. It's on our body surfaces, and it has not been so vicious in all these so many years. COVID has caused people to be debilitated. Once debilitation sets in, the body gets immune compromised, and as immune compromisation sets in, these fungi, bacteria and viruses which reside on our bodies, they tend to become aggressive and invade the body. Also, people have uncontrolled diabetes, obesity, and immune compromise for other reasons also, with the COVID, they become very deadly concoction for getting this black fungus in a very virulent form.
Doctor, but if somebody contracts the fungus, then how fast will the symptoms show? What are the symptoms and how fast a person should approach a medical practitioner or doctor?
Okay, so I'll take this back a few minutes earlier. So this aspergillus can come into patients who are COVID positive, but COVID positive with uncontrolled diabetes, or COVID positive patients who have great severity of disease requiring long-term hospitalization, especially ventilation, long-term steroid usages, even immune modulating drugs, or if you have cancer patients who are already weakened with COVID, transplant patients with COVID. So there are numerous people like this in whom this black fungus can become a virulent form. The black fungus can rapidly escalate its presence within 72 hours of being infected. So which means if the body gets infected with this black fungus, within 72 hours it can start rapidly growing within the nose, the sinuses, and the lungs.
So the symptoms can be visible within 24 hours to 48 hours.
The symptoms will range in severity based on the amount of infection. So if it's only inside the nose and the sinuses, initially you'll have a running nose, sneezing, redness in the nose. Then as it invades the sinuses inside, then it will start giving a redness around the eye pain, maybe double vision. And as it invades towards the brain, it will cause intense headaches, vomiting, altered sensorium. So it will escalate from just a running nose. And very often, black fungus people complain of a black and blood-stained discharge from the nostrils, which would be foul smelling, musty smelling. So it's an escalation of symptoms from a running nose to intense headaches and vomiting, altered vision.
So what is the best stage for any person to approach a doctor? Because running nose it looks very common, and with the change in climate right now, it will be very, very common. So when should a person actually take a call ki okay, this is not just a normal running nose, this can be something more?
If a person has a normal running nose and the person is otherwise healthy, for example, a young male or a lady, otherwise healthy, no comorbidities of uncontrolled diabetes, such a person really need not worry. But if the person has uncontrolled diabetes as in the last 5-7 years with absolutely bizarre blood findings, blood readings, and that person has a running nose and a foul-smelling nasal discharge, that person must go to the hospital immediately. One. Secondly, if the patient is immune compromised, which means a cancer patient or a patient with a transplant, these people must go to a doctor the minute they have a bad running nose with a foul smell in the nose. COVID patients, of course, will be examined by the doctor inside the hospital. And as soon as they get a bad smelling discharge from the nose, redness around the eyes, headache, the doctor will examine them within the hospital.
So, doctor, what about the treatment? And we are also hearing that this is happening to people who have recovered from COVID, but then they are contracting the infection. So tell us about both, the treatment and this post-COVID scenario.
We'll look at the post-COVID scenario first. Luckily, numbers of people who are getting better is very, very encouraging. Discouraging is the fact that younger people are getting COVID positive, which was not there so much earlier. But the good thing about younger people getting COVID positive also is that the recovery is in a better trajectory. They recover much faster. Older people take a little longer. But having said this, the recommendation is that for people across all severity of COVID infections, we will not look at them as being normal till about a month after the infection. Whereas people have spoken about 10 days for mild COVID, 14 days for a little moderate COVID. But till about a month's time, we cannot be really sure that the person is totally negative.
No, not only in terms of
Um,
COVID, doctor, the person, can somebody who has recovered from COVID contract the fungus and the infection?
Correct. So after recovery from COVID, there is always a possibility that the person can contract a bacterial infection,
Hmm.
say a fever coming in again after COVID with a pneumonia
Hmm.
or a bad sinusitis, and that sinusitis in an uncontrolled diabetic will definitely lead to a good chance, a very good chance of getting this black fungus.
Hmm. So the most worrying
If that
signs.
happens,
So most worrying sign or a most
yes.
worrying marker is the first three categories that you told, and a post recovery uncontrolled diabetes plus a recovered
Yes,
patient.
yes, uncontrolled diabetes, recovered COVID patient with a running nose, headache, redness
Hmm.
of eyes must see the doctor immediately
Hmm.
because there's always a possibility of contracting a black fungus.
Otherwise, you are saying, because I'm making it clear to everybody, so why there should not be super panic is because this black fungus that we call, and the name also sounds very scary. It is
Hmm.
always there all around us. We inhale it
Yes,
all the time. So it's not something
correct.
that you are going to be very cautious about something. We inhale it all the time. It becomes dangerous in these particular situations that doctor told us about. Doctor, let's come to
Correct.
treatment. What is the treatment for it?
On diagnosis, the diagnosis is by doing an endoscopy in the OPD or even a routine swab that your general practitioner can take
Hmm.
from the nose. It is cultured in the lab immediately, checked under the slide, and as soon as we know that we have Aspergillus niger, which is this black fungus, or any other fungus, Candida
Hmm.
is a possibility also, then we put the patient on oral antifungal tablets
Hmm.
normally as the first line. But most importantly, more than this, the comorbidity of, let's say, uncontrolled diabetes must be very severely regulated. That
Okay.
is most important.
Hmm.
Once we do this, the bulk of the patients will recover based on oral medication alone. However, the ones debilitated or more infected will require a surgical removal of the debridement. So you cut the fungus around the fungus completely into all the dead tissue that
Hmm.
the fungus is thriving on till you come across healthy tissue.
Hmm.
So when we operate through the nose, most often endoscopically, here also in Manipal Hospital, we will operate using a debrider to cut through all the dead tissue, the slough, the fungal ball, the fungal mass, take it out completely till we come across healthy tissue, regardless of how much tissue we have to sacrifice.
Hmm.
That's the only way out. It's called a surgical
So,
debridement. And after that, we will put the patient on intravenous antifungal medication called amphotericin B, which is the most popular one,
hmm.
and that's what we would like to use.
Doctor, so you are saying not everyone has to go through surgery.
No, no, not at all.
Hmm. And the key to this is early detection and early treatment.
Yes, you said it right. The key is if you are getting nasal discharge, which is foul smelling, possibly blood stain, if you are likely to have pain around the face, redness around the eyes, please do not ignore it. More so if you're a diabetic and or if you're a recovery from COVID, please go to your local doctor immediately.
Doctor, my final question before I let you go, when do you see this? Have we crossed our peak, or you are saying that the numbers that we are seeing right now is because of the curfew? There is no way we can be complacent.
I feel optimistic.
Hmm.
I feel we have crossed the peak and we are on the way down.
You are saying we have crossed the peak.
I feel so, yes.
Doctor, very optimistic words, gives me a lot of points to cheer and lot of points to feel good on this Thursday evening. Thanks a lot for joining with us. Very important insights. COVID and black fungus, I think it's a very deadly cocktail that is going on not only in somebody's body, it is also going on in everybody's head. So thanks a lot for clearing all the doubts. I think everybody will be quite clear now what is COVID, what is black fungus, and how both of these are related. Doctor, thanks a lot for joining.
Thank you very, very much for having me over.
Thanks,
Thank you.
doctor. Yeah.